If your back is 50 years old, you ought to be able to do this and this and this and this. Today, we are going to talk about the back, the low back, and namely the lumbar spine of the back. Now, in the previous episode about hips, I said that that is actually a very important part of the body that for affecting the knee and affecting the back. Many times people are having problems with back pain and stiffness that really should be attributed to the hips. If your hip rotators are tight, that's this one. And if your hip flexors are tight, and that was the one I had you do this, then you are going to make your low back work twice as hard as it should. And many times I've seen where it can cause some pretty significant damage with your disc and even for some people, the bones themselves. So we're going to take a look today at what are some ways that you can improve these types of motions in your low back. Okay, so I am going to show you 3 stretches lying down. And these will be, I'll explain a little bit about each of them, but these are basic stretches, but sometimes they are a little difficult. But the first one I'll do, we'll just do the flexion one, which is to help you to be able to reach over and touch your toes. And you're going to realize that some of these abilities to move do require flexibility along different areas of the body. But we're going to be hitting the back part today. And so when we're doing the first one, this one is your knee to chest. And basically, you're starting with your knees down, and you're just bringing your knees straight up to the chest, and they should get up to the chest. I have seen people that have range of motion, and they can only pull it up to here. That's tightness, okay? And I know there's different shapes and sizes and everything, but if you have a pouch and you're not you're able to get up, understand that when that exists, you are leading to inability of the back to go through the full range of motion. All right, so we've got to find ways to gain that capacity again, um, to do some workarounds. But this is a very, very good stretch to do. If you've been standing a lot, uh, usually feels good to stretch yourself out into flexion. And this will start to release some of that back tension as well. All right. The next stretch we'll do is for the extension of the back, and that's the one where you're leaning back. Now, to explain this one, there are a lot of connections between joints in the what we think are only hip related, and we call it hip flexors, but the connection attachments go across the hip joint and attach to your lowest part of the spine. So this is a very important stretch for releasing when you may feel pain in that center part of the very low back, especially if you do a lot of sitting. If your job, you're working at a computer, at a workstation that makes you sit a lot of times, then this is going to be a very important stretch for you to do. And so with that one, it's coming onto your belly, and you're going to do this as you can. So the easiest way is to come up onto just your elbows. And for some people, that's enough. They feel a stretch, and they really will feel it right here. But it's because the muscles are being stretched that attach to that area. So this is your kind of level 1. And then your level 2 is more coming up and extending the elbows. And then for some people, I mean, for me, I don't even really stretch this much, but you really can come up and the hips, really, really drop down. The key is that your hips, you want them to stay down to the floor. So if you come up to, let's say to here, and how do I copy it? You come up to here, and you find yourself coming up off of the floor, then you need to stay down in this area until you get that kind of flexibility. Again, very, very important exercise for back pain itself, especially if you're a person that sits and you are bending at the hips for several hours a day. And that's going to tighten you up again at those hip flexors. But that's why we need to stretch those out so that we can get more extension and mobility in the low back. The next motion that you should be able to do is side bending. And this is an interesting one because it's kind of like the neck. If you saw the neck one, a lot of people lose flexibility. And this one, when you are moving optimally, the opposite side, the way away from where you're bending, should be opening up and should be lengthening. But you have muscles that are there that, if they're tight, they won't allow you to do that. But you also have joints that are smaller joints along the spine that a lot of people get arthropathy. They get a kind of arthritic condition in there, and so what's supposed to happen is that when you side bend, those joints should actually open, and when you're starting to stiffen, they're not opening up like they should to release you to be able to move. So it's a combination of joint and muscle tissue, but this is straightforward, and the key is range. Context. Some people, when they come in and they have back pain, they many times have limited range of motion sideways, and limited can look like this. So they're moving, and you're like, well, I'm side bending, but that's not the full range. When you are really getting the mobility through that spine like you should be able to move all the way down to the side, past the knee joint, and then onto, kind of like we say, the fibular head. There's a little nodule on the side. I like even go further than that if that's possible. Okay. But that's like your minimum. Get to your joint line of the knee, go past, get to that little knot there, and see if you can get past that maybe a couple of inches. If you're able to do that, then you have great mobility. And again, if you're limited in that, don't get discouraged by it. That just is a cue for you to do this as a stretch. Now, when you are doing these stretches, you can move them back and forth just like I'm doing right now, especially with this one. But I always encourage people to kind of hang out on the same side and do that maybe about 10 times. Hold each one about 2 counts. And then for the very last one, you can hold that for that 30-second hold. If this is something that creates a lot of stretching for you, which will be along the side of your trunk typically. Try it. Another way that is important for your spine to bend is into rotation. So we've talked about bending forward, extending back. We're talking about sideways and rotation. These are all the ways that the joints of the back should be able to move. Now, this one involves your middle back as well, and we're going to be talking about that in another video. But when we're looking at improving our rotation, there's a couple of ways to do this, and one is I'll show you two variations, and it kind of depends on like what feels comfortable for you. The variation number one is to just bring both knees to the side. And now this seems rather benign, but again, the observation is that many people, when they're having back difficulties, they are really not able to complete this whole range. And so, full range of motion is back is flat, upper back, and the thighs come all the way down to the floor that you're lying on. And again, many people, it can look like this. And it's like they're afraid to move. But, ladies and gentlemen, this is your full range of motion. Your back is 50 plus years old. This is what you want to maintain and keep. It's critical. Okay. So that's one variation of a trunk rotation exercise. Another one is to bring the knee up and bring that leg over and let it stretch over all the way over and again towards the floor. Okay. But this one is it's a very good stretch, but it might be too much if you're really not moving well with the very first one. So if you can get the first one down pat and mastered, then definitely move over to this one, because this definitely gives you more of a full stretch of the trunk, and it hits a little bit of that mid back as well. Okay, hope you tried that one too. One last position of stretching I'm going to show you is one that is going to be something you can do if you've been on your feet a lot. People a lot of times they get sensations in the back, and everything is labeled as, oh, pain, 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 and that's not really the case. We just need to be more aware of what type of sensation that we're having. But typically when you've been on your feet a lot, you just get achy or you get sore, and so this is a great way to decompress the spine. Now, many people know this as a child's pose. I do not subscribe to yoga, so this is a kneeling spinal decompression or a kneeling spine rest exercise. And it's a very basic one, simple one. And what you're just going to do is basically, starting up on your hands and knees, but you're just going to come down and you're going to just rest and fold into this area, this position, and just allow the tissue to stretch and relax. And many people may feel like this is a place that you can hang out. And with stretching, we can do like 3 times 30 seconds. So I can literally hold this for 30 seconds. And each of the stretches I've showed you, you can do it that way. I can hold it for the 30 seconds, come up, and then repeat it again and do another 30 seconds. And again, that's for pretty much each of the stretches, except for the way I showed you how to do the side bend. And these are all just a very basic program to help the back to remain flexible. And hopefully, if your back is 50 plus years old, you're able to do these. And if you are having trouble with it, try them out. Try them out for several days. Do go through and look at the ones that you're having difficulty with the motions, and make that a part of a regimen. And if you're consistent, you should see changes that take place, over the course of a week. And if you're having problems and you're stuck, then reach out to me. Maybe there's a little bit more going on. Try it.